Welcome back to the EDS Scan Data series. In this video, we'll explore the purpose of single-unit implant scan body scans and how they help pinpoint implant site locations for highly accurate digital impressions. You will master proper scanning technique for implant cases and better understand how to communicate critical scan body details to the lab to ensure efficient workflows and precise restoration. Single-unit implant scan body scans work much like EasyRef or scan flags. However, these scan bodies are specifically engineered for single-unit implants, making them ideal for precise site location capture. To accurately capture a single-unit implant scan body, begin by scanning the upper arch, lower arch, and bite registration before placing the scan body. Then, insert the scan body into the implant site and scan the surrounding area. Many companies manufacture their own scan bodies, each with unique shapes, sizes, names, and designs. To avoid delays, include the scan body's manufacturer and part number in the notes section of your case submission. Without this information, identifying the correct scan body becomes time-consuming and may slow down the case turnaround. If you have any questions, please reach out using the contact information on screen. Thank you for watching and happy scanning.